Good morning or good afternoon, depending on where you are located. My name is Melissa Faulkner. I am the VP of Marketing for our Digital Health Hub Foundation. We are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center of Healthcare Innovation. Now in our sixth year, our award program is dedicated to identifying the most transformative, disruptive, and innovative companies that are shaping the future of healthcare. This year, out of over 1,500 applications, 300 were named quarterfinalists, and we narrowed it down to our 150 exceptional finalists. Today, we are proud to present our six best in class and nine rising star finalists in our women's health category, leaders who are truly revolutionizing the industry. As a reminder, this session will be very fast paced as we have 15 companies to present, but this is only a small taste of what these companies have already shared as part of their application. I am now pleased to introduce Dr. Stephen Klasko, one of our executive producers and hosts for today's session.
Well, thanks. Thanks so much. I could not be more excited about this. As an obstetrician, recognizing that women's health has always been underrepresented, from research to equity to now the digital world. You folks really represent what I think is the foreground of this revolution. My first startup was called Spirit of Women in '85, pre any SaaS. And our stealth part of it was called NJRO, not just reproductive organs, because prior to Spirit of Women, every hospital and health system just had ovary centers, uteri centers, et cetera. And just the concept of creating women's health was so important. Going through these 15 companies that you folks represent, not only are they, in my mind, just revolutionary as it relates to women's health, but certainly looking at everything from personalizing health to bringing population health and social determinants, from philosophy to the mainstream of clinical care and payment models. Literally, if we could just implement all 15 of these, people and women in particular would lead much healthier lives. So I'm thrilled to be part of this. I'm thrilled to get this going. And Melissa, I'll turn it back to you. Michelle.
Thank you. Now I'd also like to introduce Dr. Brittany Barreto, who is our category champion for this category.
Hey everybody, it's Brittany. If you are in femtech and don't know me, that's surprising. We should meet. I'm Dr. Brittany Barreto. I'm the host of Femtech Focus podcast, founder of Fem Health Insights consulting firm, and now the author of best-selling Unlocking Women's Health, which is now available. We actually sold out on Amazon, so you can put in your next pre-order for the next shipping. So Unlocking Women's Health available internationally, Amazon, Barnes & Noble, bookshop.org. And I am just absolutely thrilled to see the growth of women's health. You know, when I first got asked to be the category champion for this awards ceremony, it was the first time they had a women's health category. And as we know in femtech, we seem to be sometimes, not considered in the first rounds of things. But then once we're in it, usually the organizers or whoever, whatever this entity is that invited us in, realizes that women's health is the most exciting, best, interactive. I think we had one of the highest application rates. So women's health is just booming. I'm so proud of each and every one of you. I'll put my LinkedIn and email in the chat. I really mean it. If you and I haven't met yet and you work in women's health, I'd be happy to give you my office hours link. I'm here to support you and see you succeed. Excited to be here.
Thanks so much, Brittany. We also have Sasha from Avia on our call to set the stage of what is happening in the space currently. Sasha, I'll turn it over to you.
Great, and great to be with you all today. My name is Sasha Kukia, and I'm a director with Avia's Insights and Advisory Group, specifically focused on transforming care delivery with digital. Now, for those of you that don't know, Avia is a network of health systems across the country that we support throughout their digital transformation journeys. And really excited to be introducing the section on women's health today. So on the next slide, we really believe that there is significant opportunity in the women's health space as the market is expected to reach $60 billion by 2030. So why is that? We have more patients that are demanding convenience, and as the head of the household, often the ones making decisions on behalf of the entire family, more attention is being placed on women's health and providing a seamless experience. We have new tech entrants beginning to gather more and more headline attention. And on the system side, operating margins continue to be weak post-pandemic, but funding continues to flow into the venture space focused on femtech. And the ongoing interest in equity and preventative care in the industry makes it even more important to focus on women's health today. So how can we impact women's health with digital? Well, a little known fact is that 75 to 85% of women are more likely to use digital tools for their healthcare needs compared to men. And there are several opportunities to disrupt this broader market within the digital space. And that's everything from home and virtual care to remote monitoring, AI-driven preventative care, equity-focused solutions, complex care management, among others. But on the next slide, I want to briefly touch on, the market is expanding and there's several opportunities to act, but what are some of the real pressing needs going on? And ultimately, most of the healthcare ecosystem isn't well positioned to identify risks, treat unmet needs, and support women along their broader journeys. For one, preventative services are highly underutilized. About 45% of women in the US have forgone their preventative services. Two, current medical training does not comprehensively address women's needs. Only about 20% of OB-GYN residencies offer menopause training, and half of them feel like they need more training and education on the broader journey. Also, current care models are not well coordinated to support the complex needs that women face. About 54% of women aged 45 to 64 have multiple chronic conditions, and we need to better meet them where they are. So how can we really act with impact? On the next slide, I'll briefly talk to some of the ways that we've supported many of our health systems in high impact areas within women's health, from specific conditions such as gynecological conditions, chronic conditions, and cancer, to the broader life cycle and thinking about sexual wellness, fertility, perinatal care journey, and menopause, and behavioral health that's really all encompassing. I'm excited that we get some dedicated time today to focus on these really promising areas and solutions in the space that we'll be pitching that have really developed innovative solutions in the market. But before I pass it off, I want to briefly touch on exciting work going on within our Avia marketplace. So a few years ago, we launched the Avia marketplace to help health system buyers across the country select digital health technologies. And over 70% of hospitals and health systems trust Avia marketplace for their tech select. So this year, on the next slide, we launched buyer intelligence for solution companies like our finalists today to really find active buyers in the market. And as a token of appreciation for all of you pitching today, we're providing you all with free access to buyer intelligence to further explore. So if you haven't yet received an email, don't hesitate to reach out and ask. And with that, I will pass it on to hear about some of the exciting pitches today.
We're sitting here 5 years from now, and thanks to your company, what are you looking back in 2024 amazed that from a healthcare perspective, women were X? What's changed, and what role has your company had in creating that change?
I'll go first. I'm Judith Nauman here with Nest Collaborative. We do lactation support via telehealth across all 50 states. And in 5 years from now, I see a focus on preventive care and really reimbursing for preventive care and the difference that it makes when we get ahead of the problems. And our role at Nest is our focus on making sure that our services are available for all Medicaid members across the nation, knowing that this is about 40% of the birthing population. This is an important target for us in 2024.
Thanks, Judith.
And I
Hi, Sylvia. Go ahead.
Yeah, so I can go next. So yeah, this is a great question. I think in 5 years we see more democratization of the healthcare for women. At what Mira is doing, we're trying to give women a at home tool to understand their hormone level, and this has never done before. And we have already saw so much potential on helping women to improve their own health, manage their lifestyle, and also helping the OBGYN and the IVF clinic to reduce their cost and increase their outcome, improve their outcome. So we really believe we got to put more data into the consumer's hands so they can understand their health better. And this democratization of the health data is really helpful for women's health in the future.
Thanks, Sylvia.
Hi, I can go next. My name's Elizabeth Gazda. I'm the CEO of Ember Labs. We produce this beautiful wearable device that can stop a hot flash in its tracks and help with also sleep issues and related anxiety. 5 years from now, we will be able to prevent the majority of hot flashes that women experience by identifying the hot flash onset 20 seconds before a woman even knows she's going to have a hot flash and stop it in its tracks. We've completed this research and it's ready to go. We want to create a world where women never have to experience a hot flash again using their body's own pharmacy. And that's where we're going to be in 5 years, maybe sooner.
Thank you. Thank you. Karen?
Hi, I'm Karen Collega, Chief Nursing Officer for Perigen. And Perigen, we are in the obstetric space. We apply AI to fetal monitor tracings and give early warning for that. In 5 years is really, really exciting because of so many of the changes in the industry. But what I think about most about in 5 years is hospital at home. And we will have the ability to have patients who are pregnant and maybe are having difficulties with their pregnancy have testing in the home and be able to transmit that information in real time and be able to give them those answers. The implications for the problems we're having with maternal deserts are huge. Remote access to care are huge. And I truly believe that is where we're going to see just massive growth in women's health there. One of the things we need to be cautious about is the digital divide because we don't want those future technologies to impact even worse and those who are having access to care. So we certainly are working with many of the different advocacy groups to see what's happening because there's a lot of legislation around that digital divide, making sure that broadband is available everywhere. That is a huge promise for the future.
Thanks, Karen. Corinne?
Hi, good morning, everyone. My name is Corinne Carmi. I'm the co-founder and CEO of Origin. We're the national leader in pelvic floor and full body PT for women. And my vision is that there will be standing orders for everyone after they give birth to get a pelvic floor rehab program, whether they're giving birth vaginally or through C-section. I hope that we look back at today's times as if we're in the dark ages around women's health and how we support folks. You get more physical therapy and rehab when you break your ankle or sprain your pinky than when you deliver a child, or when you're going through menopause and you experience, all of the issues that are so common. Today in the US, 86% of women have pelvic floor dysfunction and only 4% are getting diagnosed. So this is an issue of epidemic proportions. And I hope that not only is this accessible, that it's affordable and network for folks around the country.
Thank you. Fahima? Did I pronounce that right?
You did. Perfect. Good morning and good afternoon to everyone. I'm Dr. Fahima Sassan. I'm a board certified OBGYN, Kindbody's founding physician, and also serve as our Chief Innovation Officer. And I think what I would highlight we do in 5 years is actually what we do today as well. And I think it's really merging together virtual telemedicine with in-person care and recognizing that truly the combination of virtual care along with the in-person care and having that continuity that we provide is such an essential part of medicine when it comes to fertility, reproductive health, menopause, through all of the stages. And so really being able to, from the convenience of a person's phone or digital platform, tie in the digital to the virtual to the in-person care, whether it's diagnosing, managing, or treating the full spectrum of reproductive health, including male fertility, which is obviously a huge aspect of infertility issues. And as we look into 5 years from now, it's really taking that woman from menarche to menopause and everywhere in between, and men from puberty to that low testosterone andropause period, and recognizing that there's so many deserts, both from a physical perspective as well as a care perspective in the United States, that need to be addressed.
Thank you. Marina?
So today in the US, there's 50% of households using smartwatches. And we envision in 5 years that it will be the same for tracking hormones. We're introducing a product called the Hormone Meter, enabling people to measure hormones in a way that's as easy as brushing your teeth and as affordable as a coffee. And we envision in 5 years that this will be used at scale to enable the 80% of women that have hormonal symptoms to understand what's happening on a daily basis, but also to create the data sets that enables research to move forward and to enter a way of approaching hormonal health in a preventative way based on that data and accessibility.
Great. Jennifer?
I'm so excited to be in this room with you women. Just an honor, and thank you for having me. In 5 years, I'm going to be like, oh my gosh, look at what I'm able to do, my daughter's able to do because of all the women in this room, which is pretty amazing. So thank you all. I am Dr. Jennifer Hinchey. I am the CEO and founder of Fertile, which is the first and only FDA cleared and sterile at-home insemination kit. I went through 16 months of infertility and invented a medical device that conceived my daughter, who is now in kindergarten. We just got clearance this year. And so I answered it up front, but I think that in 5 years, we're going to have more fertile babies and fertile moms that are going to be utilizing all of the things that are being built here, which is just so awesome to be a part of and be in the same room as all of you. Thanks.
Thank you. Netta?
Hey, I'm Dr. Netta Gottlieb, Senior Product Manager and Women's Health Lead at Aura Ring. We created this tiny ring that is packed with state-of-the-art technology to sense heart rate variability, temperature trends, sleep, to offer scores and insights about your body, your overall health, reproductive health. And in 5 years, I wish we'd give everybody a voice, so every person can really know their body and care for themselves accordingly. So that body literacy is really everyday common knowledge for every person, every woman, so we can live our best lives longer.
Nice vision. Lior?
Hi, everyone. My pleasure to be here with so many amazing leaders. My name is Lior Wayne. I'm the co-founder and CEO of Mika. Breast cancer, unfortunately, this is the most common cancer among women, and we found a way how to turn the simple mammography to be efficient and effective like MRI. We use GenAI to create a lookalike MRI image by using the standard mammo, and by that we can eliminate double screening, radiation, pain, and a lot of stress for women. And my vision that about 5 years from now, that will be accessible to everybody in a low rate, less than 25 USD. And by that will be accessible also for underinsured and everyone around the globe. Thank you.
Great. Is there anybody I missed?
I haven't gone.
I'm sorry. Okay. Let's go with Catherine and then Arfa. Catherine?
Yeah, thank you. Yeah, I'm Catherine Song, co-founder and CEO of Sound Over Health. Well, as you guess from our name, we are using bathroom sound for keeping an automatic boarding diary. So using the AI algorithm, I measured automatically of the amount of fluid from sound. And yeah, this journey will begin with my mom's story that she suffered from the bladder disease, the significant interstitial cystitis for more than 30 years since I was a very young girl. So I completely understand for the patient herself and the caregivers for the quality of life degradation. She always felt that doctors not fully would listen to her, and she really felt really hard to describe about her symptoms, and the bladder and the bathroom issues are very private, reluctant to talk about anyone to seek proper health. But the bladder health is really critical. The more than a half of the women were related to the pelvic health really suffer from that, and often overlooked aspect of women's overall well-being. So the many people experience conditions like a urinary incontinence of rectal bladder and urinary tract infections, which can significantly impact their quality of life, not only for the physical, but the social and even to the mental health. So we are making an AI-based automatic bladder diary, try to improve the adherence to keeping the bladder diary, integrating some or the lifestyle modification, behavioral, the mental care features into the bladder diary. So I have a great privilege to listen to the simple automatic bladder diary and the sound AI will greatly improve the bladder health management. So yeah, in 5 years, I'm envisioning them reducing the subjective symptom report and objective measures, as you all mentioned, to increase our bladder body literacy and return our dignity with our life. Yeah, that's my vision. Thank you.
Thank you. Arfa?
Hi, everyone. My name is Arfa. I'm the co-founder of Caria. We're the world's first clinically validated digital therapeutic for menopause. The future that we're enabling at Caria is that instead of the several years of trial and error that women currently endure, it takes women 2 minutes to understand if they're in menopause and what the right personalized treatment is for them, and the treatment actually works. We're also enabling a much better understanding of menopause with more research and data. We're proud to be building the world's largest data set on menopausal health and believe it can be a huge unlock for improving our understanding of what's probably the most significant transition in women's lives when it comes to their longevity. I also believe in 5 years from now, menopause will very much be a mainstream women's health issue and not an afterthought, with equal, if not more, innovation as all other areas of women's health. And when a founder is raising funding for the next gen menopause solution in 5 years, I hope no VC is saying that this is not a real problem and there's no market there, thanks to the work that many people in this room are doing.
Thank you. I think we have everybody now. So I want to move to the. I'm sorry. I'm sorry. You're on the bottom of my screen. Sorry.
No problem. So I'm Shelley Lanning. I'm a co-founder and president at Visana Health. We are a virtual women's medical clinic, and we treat dozens of women's health conditions from menstruation through menopause, offering a comprehensive whole person and coordinated care model. In 5 years, what I look forward to offering is this increase in the amount of data that's available. Today, as we all know, there's been such a lack of research, lack of evidence, and we working together are all shoring that up. But at Visana, we're no different in that we are collecting the foundation of everything we're built on is to collect extraordinary data related to clinical outcomes, increased access, significantly increased access. Our model uses top-notch medical, but also whole person care, and a actuarially validated a reduction in total cost of care. Because as we know, costs drive everything. So thanks for having me.
Thank you. So I want to move to the present, and what I'm going to ask you to do is based on what you're doing today, if you could share one real outcome, short story or use case that is happening today and positively affecting the women that are using your product, that would be great. So Netta, I'm going to start with you and Aura.
Thank you. Yeah, the Oura Ring is truly revolutionizing women's health by providing personalized insights and empowering members to make informed decisions about their health and reproductive health, really being a window to overall health. We have lots of really inspiring member stories on our blog, and one of them that I'd like to share, I find deeply moving, is McKenna's story. McKenna was an Oura member for a few years, tracking her cycles, and she noticed that she has irregular cycles. She didn't think too much of it until she observed spikes in her temperature trends and started experiencing hot flashes, which led her to seek medical advice. And after seeing her doctor, she was diagnosed with primary ovarian insufficiency at the age of 27. So this is essentially early menopause at the age of 27, and this would make having kids really difficult. And for McKenna, this was a life goal. And like many other women in their late 20s, she prioritized her career and wasn't thinking or planning towards that goal. So had she not paid attention to her body, had she ignored all the signals, she could have missed the boat. But because she hadn't, she used the ring to track her biometrics, learn about her cycles, how her body is changing, and use that information to take to her doctor and start the conversation. She was able to advocate for herself, learn about what her body needs, and take the actions she needed to meet her goal. And now she has a beautiful baby girl.
Wow. Great, thanks. Lior, could you give us one outcome that is existing now with Micah?
Yeah. Actually, I have 3 stories, but I will start with only one. Her name is Hagit. And one day when we had a meeting in one of the hospitals that we used to work with, we checked a retrospective data of mammographies of women. And one of them, I asked the radiologist to use Mika to analyze what is happening there. And I want to remind that this is a retrospective. The lucky was that this girl, Hagit, was there just a few days before. And by using Mika, we just enhanced and highlighted a suspicious lesions that were hidden behind the dense tissue. As we know, about half of the women have a dense breast tissue, and half of them will take another exam like MRI or ultrasound. In this case, the physician just missed behind the dense tissue the lesion, and Mika just cleared that and enhanced it. It was very big. I asked the radiologist to do everything to ask Hagit to come back to the clinic, and I can say that Hagit is now a happy mother of 3 kids, and I really want to believe that Mika just did one miracle in this case.
Thank you, Elizabeth. How about Ember?
Yes, one of the most moving stories that we experienced was, of course, we know that the product is very effective for women going through natural menopause, but we received an email from a woman who had stage 3 breast cancer and told us that she had basically given up on most of the things she enjoyed in life, including exercising, sleeping properly, and her job. And she told us that the product had absolutely changed her life because the product was able to address the medication-inducing hot flashes that she was experiencing as part of her treatment. She also let us know that she discovered if she could start the cooling during the aura effect of a hot flash, she could stop it in its tracks. And that insight led us to the research we conducted, where we now have identified the biomarker for the onset of a hot flash and can stop it.
Thank you. Catherine, story would sound.
Oh, yeah. So, yeah, as a inventor of the AI technology behind our bladder diary app, Bladly, I have the privilege of witnessing firsthand how our solution has positively impacted. And our first customer actually was my mom and my other women co-founder and my friends and family, the more. So, yeah, one woman, let's call her Sarah. Yeah, she was struggling with frequent embarrassing accidents, sudden leakages and orgies. So she felt very isolated and self-conscious about her symptoms and limiting the social activities and professional jobs, and suffered in silence because it reluctant to share about the symptoms, and she didn't know which specialty or which doctor can help her. Is it treatable or not? But after using this app Bladly, she was able to track her symptoms in an objective and a subjective manner with a more comprehensive view. She can identify her triggers, what makes her feel the very certain urges or the bad symptoms, and communicate more effectively with the numbers and the charts with a doctor. So with this AI-powered automatic volume measurement, it increases overall patients' adherence to keeping the bladder diary. Typically, it is known in less than 30%, but it increased more than twice, 60-70% with a high with the satisfaction. And this era, she gained a deeper understanding about the bladder patterns and was able to make a more informed decision with the doctors about her treatment, even with the long course of the treatment from the 6 to the 12 months. But as a result, now she's much better, improved significantly, and get confidence about her life and get back to her communities and get back to her job with no interruptions. So she sent her this letter. So when we feel sometimes depressed due to our hard work, you read that letter and they share their feelings together. And yeah, that's our story.
Thank you, Catherine. How about you, Sylvia, with Mira?
Yeah, sure. So yes, so we have many success stories. So we have more than 130,000 users, and we help them to get pregnant. 84% of them got pregnant within 6 months. So, and especially this including a lot of people with PCOS and irregular cycle. So one of the most moving story we had was there was a user, and she was close to 35 years old, and she was trying to for her second baby. And she came out from birth control, and her cycle was such a mess. And she was saying OBGYN and the OB said, well, this is like you're fine, your husband is fine, so you guys just have something called unexplained infertility. And this is super confusing for women and for their family because there's really nothing they could do, and it's just based on luck. You're gonna get pregnant today or not. It's just based on luck. There's no action. So she was still desperate trying, and she doesn't have any results. And at the time, she found Mira, and she's like, "Wow, this is gonna cost me a few $100s." And her husband is like, "Well, otherwise we're gonna go to IVF, so that's like $30,000. Maybe just give a try, and regardless it's gonna work or not, just worth to give a try." And then she tried Mira, and then she found that she has a luteal deficiency, which means the progesterone doesn't really release properly after ovulation. That's actually a pretty common problem for women with a little bit older age, but you usually don't feel that. You can't tell unless you test your hormone. And then she identified her ovulation, and she tried for a baby whatsoever. But she already scheduled her IVF. So she went for the IVF session. And at the first ultrasound, she found that she has already pregnant with Mira's help. So she told me this because we had the we had a webinar. So we host a lot of webinar, which is free for our users. Invite the doctor, invite the patients with the success story. And then she joined, and she was like a speaker. And she told me this live with like thousands, hundreds of people on the webinar as an audience. And then she said this totally changed her life because she's like she prevented this cycle of IVF, which is like a $30,000 out of pocket cost, and with a lot of uncertainty, emotional stress, and also absenteeism. Like if she has to go through IVF, she has to go to the lab to do the blood drawing, and which is really have to be taking a half day off and just to get that done. So yeah, so that was really, really touching for me because a lot of detail, and you can totally see the struggle, emotional, like roller coaster, not mentioning about the financial burden a woman was trying to go through. And this kind of cases are so typical around me. People like 30, 35 years old, and they struggle with all this kind of thing. And this Mira as a tool really helps them to really see themselves, really understand their own data so they can take a proper action.
That's a huge issue. Thank you. Judith? I think you're on mute.
Thank you. This year in 2024, we at Nest Collaborative completed at home, let alone stand up and walk and get herself into a clinic for breastfeeding support. And because of Nest's telehealth breastfeeding support, this IBCLC was able to offer her all the guidance and support she needed while she was in the sideline position. And she didn't have to even sit up to get the care that she needed.
Great. Jennifer?
Well, Fertile started as my story, which, at 32 years old, I had waited until after my doctorate to settle down and have kids. And then I, like Sylvia mentioned, was diagnosed with unexplained infertility, which is a diagnosis that when you give a scientist, she will take it into her own hands and figure out a way to explain it, which is what I did. What we're finding is that, our proof of concept kits, we had 34 self-reported pregnancies from our first 200 kits. And when we launched earlier this year, we actually had our second set of siblings that have come from our now FDA cleared and only sterile kit. And really what we're seeing is just Fertile is a option that people can try that is as close to the clinical sterility that you can get, but with the same privacy and comfort as at home. And so our fertile families and babies those stories are really what keeps us going every day.
Thank you, Jennifer. Arpa.
So one common theme in our community is women who are high risk for specific conditions looking for alternatives to hormonal therapy for menopause. And this is a pretty significant segment of women who doctors usually have very limited options for. So we had a user whose mother had been diagnosed with breast cancer in the past while on hormonal therapy due to poor monitoring. And this user was determined to find alternative treatments for herself. And when she went to her doctors, they kind of threw up their hands and said, they didn't really have many options or suggestions for her. Then she found Caria, and within a few weeks, she was able to get her symptoms in control without the need for drugs and medication. And since then, we've concluded a randomized control trial, the first of its kind, in which Caria's behavioral health program was shown to significantly reduce some of the most disruptive symptoms of menopause, like hot flashes, depression, and insomnia. So we're really excited to bring this kind of solution to more and more women so they have access to diverse treatment options that are personalized to their needs.
Thank you. Corinne?
So Origin has the benefit of being both in person and virtually, and sometimes I get to experience, the magic that happens when you're in person. And I was in one of our clinics recently and was told by our staff that there was actually 3 women from the same family in that day. It started with a patient who was recovering postpartum, very common issues, incontinence. She also had mommy thumb, which is kind of what happens when you're breastfeeding or holding your child a lot. And so she was getting care, and ultimately told her sister, who was younger and had experienced chronic tailbone pain, that was actually pretty underdiagnosed. She had gone to different physical therapists, ended up at Origin, and was finally getting the care she needed because it was comorbid with her pelvic floor dysfunction. And then her mom was coming in for prolapse as well. And so for me, the idea that this care is so intergenerational is so critical, because it's not just a postpartum issue. It's not just a menopause issue. We have these muscles throughout our lives, and we need to be treating them holistically. So it was really inspiring for me.
Thank you. Karen?
When you look at the intrapartum space, when a mom's on a fetal monitor, unfortunately, the majority of fetal injuries that occur during birth are considered preventable. And if you look at trends, it's all about failure to recognize trends that are worsening. And a lot of that is human factors. But what we do is apply AI to that to really make it objective information, because historically it's a subjective interpretation, which I'm sure also has a lot of variance. So we have a partner in Louisiana who was able to realize a significant reduction in NICU admissions, and at the same time not increasing the C-section rate, because that's always that sweet spot. Typically when you really improve your neonatal outcomes, you see a rise in C-section rates, and we already have quite a high rate in the United States. So at aggregate levels, we're seeing really great outcomes for neonates. As far as a specific story, we have our technology is installed in a clinic in Malawi, Africa, along with the Baylor College of Medicine. They have been able to realize an 86% reduction in stillbirths. I mean, that's phenomenal. I think they checked the stats 5 times because it seems not realistic. But yeah, over the last 2 years, we have, seen about 200, of 200 babies that are now living. That clinic has gotten the attention of the Bill and Melinda Gates Foundation, and I had the opportunity to travel with that team to Nairobi, Africa, where we are looking at installing in 3 different facilities there, hopefully, and realize the same outcomes. I think the takeaway is that there's incredible potential to reduce poor outcomes in resource-limited areas, and we have some resource-limited areas in the United States. But there's a great video we have from Malawi of a patient that was a nurse at the clinic herself, and like many nurses, working through her pregnancy, and wasn't feeling great that day. And they put her on the monitor and used our technology. And, you know, it's just an incredible story that she says, without PeriGen, I don't think my baby would be alive.
Wow.
That one is huge.
Thank you. Marina?
So one story I'd like to share is mine. When I started the company, it was because I was experiencing hormonal symptoms on a daily basis, looking for a solution to manage those hormonal symptoms without finding any. So that's really the reason why we spent years of R&D to make that technology possible. And today, for me, it's one of the most powerful things I've experienced in my life, being able to manage the symptoms I experience with the technology we develop, and being able to live my best life to then enable more people to use that product and experience the same life-changing outcomes that I did. Beyond my own story, we're speaking with women on a daily basis to collect their testimonials. And one that deeply touched me recently is a woman who is experiencing perimenopause. And due to the many symptoms she was experiencing combined to a chronic condition, without any solution to manage the hormones and being able to see the root cause, she was at a point where she was experiencing thoughts of ending her life, unfortunately. And being able to now have this data in her hand, she shared that for her, it gave her the power to have control after years of not having it. And for me, that was something I never realized. I know that hormonal health, when it's not being addressed, can be life-threatening, but that's another angle of life-threatening that I hadn't even considered before getting that testimonials. So for this reason, we're really excited about the impact it has not only on her life as a team, but also for users.
Thank you. Fahima?
Yeah, there's, again, I want to echo so many stories, but I think the most profound thing that Kindbody has done is the story through our Center of Excellence program with Walmart. So Kindbody today serves over 3 million people through their employer benefits, so that they're now having access to fertility and family building benefits, including adoption and surrogacy, that they would not otherwise been able to. And the Walmart story is particularly important because it's people who would have otherwise never had access to this care, part-time truck drivers, cashiers, people who would have never been able to afford IVF care or have access to this type of care. And so the one couple that comes to mind is a couple who's from Somersville, Kentucky. I had to Google it because there's only about 300 people that live in Somersville, Kentucky. You can imagine a town that has 300 people certainly doesn't have a fertility clinic, much less a lot of subspecialty services. And this couple had been trying for 6 years as a young 30-something-year-old couple and had had 12 inseminations because that's all that was available to them in their even neighboring towns. And we met with them virtually because that's the way the program works, trying to reduce the impact of travel. Met with them virtually, was able to do their workup for them virtually, and then they only had to travel once to their nearest Kindbody clinic, had one IVF retrieval, one embryo transfer, and their baby will be celebrating its first birthday in a few months. And so I think it's stories like that. And this is just a person who works at the local Walmart, of a town of 300 people, as a blue collar worker. And I think it's those stories that really, give us our mission and vision. And I'm sure is true for everyone that's on the call. But the access to care, I think, is the most profound story that I would share.
Thank you. Shelley?
I'd love to introduce you to Sophia. She is a middle school math teacher and a real Vasana customer. Sophia suffers from endometriosis that started as painful periods in her teens. And by the time she was in her late 20s, she suffered from extreme pain that caused her to miss work on a monthly basis and actually land in the ER on a couple of times a year, every single year. Sophia had recently gone through myomectomy, a laparoscopy, and then resulted in a complete hysterectomy all before she was 32 years old. And of course, this put her into complete menopause. Within 6 months, she was having reoccurring pain, and her clinician wanted to do yet another surgery, despite not having any of her female organs left. So Sophia came to us through her employer benefit team, and within 48 hours or 3 days, she had a 1-hour appointment. She'd seen an OBGYN specialist. We'd pulled all of her prior surgical records, and we're able to discover that she had multiple comorbidities that were impacting her care. She was in surgical menopause that was untreated. She had hypertension, she was pre-diabetic, and she suffered greatly from anxiety. So we were able to use a long appointment time, specialists, have her work with our doctors and health coaches to incorporate medications and diet, exercise, nutrition, mental health support to be able to have a care plan that within just a short period of time of less than 4 months, she was feeling so much better. She did not need to have another surgery. She felt complete control of her care, was able to work regularly to better understand all of the iterations. And it's now been 18 months and she's been much better, hasn't missed a day of work, and no surgery.
Fantastic. Ikram, welcome. So if you could briefly do 2 things. It's 5 years from now. Tell me how the women's health world is better because of what you're doing, and then give us a story or a use case today.
Okay, sounds good. Thank you for having me. So I'm Ikram, General Manager in the US for Aspivix. So Aspivix is focused on making gynecology modern, and we are tackling pain and reduction of bleeding, especially for any transcervical procedures in gynecology. The most common one is the IUD insertion. So we are still using 100-year-old instrument that was developed during the US Civil War that was used to extract bullets from soldiers. And now we are still using it on women every day to insert IUD. So basically, this is this awful instrument that looks like very Sharpie, and that needs to go away. We know that a lot of women, we probably know personally or even around you, any woman who had experience getting an IUD was painful and even traumatic. 120 million women are just suffering from that pain. So where we see ourselves 5 years from now, we hope that our device, which is suction-based, instead of pinching the cervix, which is way more gentle, it reduces pain by 73% and bleeding occurrence by 83%. We hope that this becomes a standard of care in gynecology. So that's what we are tackling right now. We have 810 patients over the last 8 months that have benefited from it, 99% of patient satisfaction, and women around the world, in Europe, in the US, and also now in Brazil. Great experience also from the provider, and that's what we are really making. It's all about making gynecology modern. So let's get rid of the old traumatic instruments, and let's get into more empathic and safe care for women. And one story that really touched my heart, and it was around Christmas time last year. I had one woman who reached out to me out of nowhere, and she basically just wanted to say thank you. I was like, okay, let's have a chat. So we had a conversation. She's 29 years old. She lives in Philadelphia, and she called me because she wanted to share her experience getting an IUD at 24 years old, and that experience was horrible, traumatic. She basically went to get an IUD. She ended up with a huge pain that make her not able to go to work for 3 days. And that experience, never again. So when she had to renew the IUD in 2023, basically she went into depression, anxiety at the top level. And she's like, I'm not going to do it. It's 2023. It must be something out there. And she basically started doing some research. I was like, even if I think that's probably something out there, I'm not giving it a try. So she went to her gynecologist and tried to see if there's any other options. Basically, her gynecologist was like, you should probably choose abstinence at this point. So we're still in that age where you still not only gaslighted, when you talk about pain, you're not believed. and you are just judged. So that's on top of everything else. So she moved to a different state, and they gave her birth control pill. It didn't work for her. After 3 weeks, she ended up getting blood clots, and she ended up in the ED. So she only had one option, going back to the IUD. So she did some research, and she found our device, and we just got FDA clearance at that time. And basically, she asked us, where do I find an OB-GYN using it? And that's where we redirected her to Columbia University, which was our very first site in the US. So she made an appointment, she went there, and she had a great experience on both sides. It was really patient-focused experience. Not only the device worked on her, it really reduced pain, but on top of that, the clinician was also very understanding, very gentle. So it's a combination of all of that. And the experience went way better. And now we have 800 patients who have benefited from it.
Thank you. Well, so this is going to be the definition of a lightning round. And what I'm going to ask you to do, because I think so much of success is around your team and your company and the humans involved in your company, and you folks are the leaders. So I want you to come up with just 3 words that define your team, what keeps people excited, how you're being sure that you get inclusion of different voices, and given the time, literally 3 words or 3 phrases that best describe what differentiates the humans in your company. We'll start with you, Shelley.
The one that's, all right, so entrepreneurial vision, balance, being able to have a really nice work-life balance that provides growth. And I would also say committed and passionate about women's health.
Great, thanks. Fahima?
I'd say leading with empathy and kindness and being innovative.
Great, thanks. Marina?
Making the impossible possible, grit and mission.
Karen?
Yeah, it's our team's motto and the technical team's motto as well, that we hear you. Yeah, we hear your sound and we hear your story. Yeah, we're here to support you. Yeah, we hear you.
Thank you. Ikram?
I would say a passionate, very diverse team who care about patients.
Thank you. Karen?
I'd have to say joy in the workplace, because it's so important, and passion for the mission for the company.
Maureen?
I'll share 3 of our values: own it, go big, and be generous.
I love that.
Arfa?
It's a marathon, not a sprint. So celebrate the small wins that come along the way, and listen to women.
Thank you. Jennifer?
We lean into a lot of our compassion. A lot of our team has been there. We are also tenacious and relentless in the pursuit.
Judith?
We celebrate successes, both large and small, because it is a marathon.
Sylvia?
Yeah, so first one's open-minded. So we're still early stage in women's health. There's a lot of uncertainty, a lot of things we need to learn. So we need to take the information feedback from every different aspects. And the second one is keep learning. So there's always something new. There's always next stage of the thing can be different from what we have done yesterday. So keep learning. And the last one is the pioneering. So be the pioneer, have that motivation, have that passion to really drive women's health to the next stage.
Sasha? Oh, I'm sorry. Elizabeth?
Yeah, the 3 words that really embody our team: persistence, because if you're working in menopause, you have to persist, caring and committed, and authentic.
Great. Lior?
Out of the box, visionary, dreamer, and gender diverse team.
Netta, you get the last word on the panel.
Thank you. The 3 words that really embody our team is first, mission, where every single member of our team feels our mission viscerally to give everybody a voice. Second is Ubuntu, a company value. It's a word that means not I, we, and it takes a whole team to succeed. And then the third is human first, another company value, where we're human-centric, leading with empathy.
Great. Brittany, you want to take us home? A lot of amazing stories. Well, I think you could write a whole nother book based on the conversation we just.
I plan on it. I hope my current book is a historical one. And, you know, we had to come up with questions for this panel, and I wanted to make sure we asked what's a real life example of your product affecting, you know, someone's life, because sometimes we can get all caught up in valuations and how big your company funding round was, or if you're hiring or not, or whatever. And at the end of the day, we are elevating the human race. The human race, not just women, but all of humans, whether that be our ability to go to Mars in the future or our ability to sustain life on Earth. You are literally improving everyone's health and wellness. And I'm just so grateful for this industry because also we're like run by rock stars. You are all rock stars. And I know many of you personally, and you're really genuine humans. And I know you put your heart, soul, tears, blood into this. And so happy to support you however we can. And I look forward to seeing you all in Vegas. Let's grab a drink. Let's have a party.
That's a good way to end the whole thing. And thank you all. And a few of you mentioned celebrating your victories. Just the fact that you're here is just a great victory on behalf of the Digital Health Hub. Thank you so much.
Thank you again for everyone joining. As it's already been said, make sure to join us on October 21st at Health for our grand finale, where our rising stars and best in class companies will be crowned. It's 1 o'clock for the rising stars and 5 p.m. for the best in class. So make sure you join us there and have a great rest of your day. Thank you so much.